One of the things I try to focus on as a cancer physician here at Bozeman Deaconess Hospital is cancer is one part of a patient's life. It's not the patient's entire life. And again, this is a pretty wonderful place to live. And so what I'm trying to do is ensure that patients can continue to take advantage of all those things that are important to them about being here, about being in Gallatin Valley. And to keep the cancer component of their person as small as possible. This being a smaller area, I think people used to feel that they had to leave to get good cancer care. And I think to a large extent we've overcome that. The hospital has been very supportive of our efforts to continue to improve quality of cancer care. When we feel that there's a need that needs to be filled, the hospital has been very good about stepping forward and helping with that. I think most of the feedback we get has been pretty positive about the Cancer Center here. And I think that's one of the reasons we're seeing the growth in numbers. Despite, I think, the fear that people have about cancers in general, we're doing much, much better in terms of getting people through. If a patient is told that they need a biopsy, in their mind they have cancer, whether they do or not. And so from the time they hear that, they may need support for the emotional aspects of what they're going to be going through. And so we do have people in place to try to help us take care of those issues as well. Patient who had a relatively large breast cancer, presented at somewhat early age, and we quickly got her into the system and identified what would be the best plan of action for her. And I think the hospital's involvement in pushing the technology, making sure we have up-to-date technology, was helpful because breast MRI was relatively new at that point, and we were able to incorporate that into the treatment plan. A lot of what I do is very dependent on the trust that I build with patients. And even though I understand it's not an easy thing to do, it's a worse thing not to do it. So I just have a frank discussion with the patient. I try to remain somewhat upbeat. So if I tell you that you have cancer, I say, but this is what we can do, and move quickly into where can we go from here? What are the positive things we can do from this? I think a diagnosis of cancer, patients begin to rally, and it really brings out the best in patients. And they're a wonderful set of patients to work with. There's constant positive feedback you get from that interaction you have with patients. And so that's, to me, what the great part of the job is.